Hi, good morning, everyone. So it's exactly 10 o'clock. Today we have a very interesting topic, and it's very relevant, with a speaker doctor with more than 10 years of clinical experience, from chronically ill patients to patients who simply want to improve their health. I don't think there's anything he has not seen before. It's just some reminders before we start. So all questions will be answered at the end of the lecture. We will be strictly monitoring the questions. We have our NutriGates who will be monitoring your questions, so you may drop them in via the chat box. And this webinar is purely for education purposes only. So if you have any personal questions that you would like to discuss, make sure that you book an appointment with our doctor. Okay. So our speaker today, already have our speaker today. Yes, our speaker today is board certified in internal medicine from the Philippine College of the Philippines. He has extensive clinical practice and executive healthcare management experience. He is certified functional medicine at the Institute of Functional Medicine in the US and is double certified in nutritional medicine and anti-aging medicine in WASAM, India. So it's a pleasure to have with us today Dr. Rolando Balburias.
Yes. Good morning, everyone. Thank you, Maris. Good morning. I just want to correct, it's the Philippine College of Physicians. No, baka mapagalitan ako ng aking organization. So, the Philippine College of Physicians. No? So that's the organization for general internists like me. Yes. So, to start, let me share my slides. To begin, so I'll be talking about the micronutrient miracle, especially for those who are suffering from chronic and lifestyle-related diseases. No? So, good morning, everyone. I'm Dr. Oyie. No? So, this morning, our objectives is to get the facts behind the nutrient-depleting effects of the so many medications that you are taking, especially if you have what I call the 3MD syndrome. If you're having multiple doctors and because you have multiple diseases and you're taking multiple drugs, many of these drugs or medications are drug enhancing, life enhancing effects, but it could also be depleting you of certain nutrients that your body as a system needs. No, so we need to learn the art of balancing it with nutrient supplementations. No. And at the same time, of course, many of you, because everything is available in the internet now, I've had experience where patients come to me bringing their several bottles of supplements, no, because they've learned from Dr. Google that this is good for this and that, no. But you have to learn today that there are so many factors that can actually affect the absorption of these nutraceuticals, no. And at the same time, there are definitely beneficial quantities and forms that are important in consideration of the different medical conditions or lifestyle that you are having. No? So it's important for you to learn that there is such a thing as a micronutrient competitions and synergies. No? So I'll tell you later on about this in detail. So in definition, well, supplements are defined in part as products intended to supplement the diet that bear or contain one or more of the following ingredients: no? A vitamin, a mineral. At times, you also use a herb or a botanical or a natural substance that it contains phytonutrients or phytochemicals. No? And of course, not just micronutrients, that's important, even a macronutrient like fats, proteins, and of course, carbohydrates, no, for energy sources. No? So, well, the Philippine market, we've seen an increase, a 300% increase in the interest, no, because nowadays, people are getting tired, no, of really just um, taking medications, no. In fact, we now know that indeed, if you know and are able to address the root causes of why you have all those conditions and diseases, and could possibly is because of your micronutrient deficiencies, then you could actually reverse your chronic diseases, and you need not necessarily be on a maintenance medication. So the appreciation of the Philippine market or the Filipinos about this is growing. No, so there are some movements like even organizations like Greenpeace is advocating a more of a plant-based diet because that's where mostly you can get the micronutrients that your system needs. No, so we see this in the different um, things that are happening, no, as far as the appreciation is concerned. And as you can see here, the behavior of the consumers, no, 53% actually would want are taking all of this. As I mentioned, they really want to reduce the risk of chronic illnesses because we now know that indeed our health is not a cycle. It's not expected for us that as we grow old, we are expected to get sick. No, our health is a spectrum. Hence, we have a decision. We have a say into it. No, so the aging is inevitable, but the rate of aging is something that we have control of. No, I mean, there's such a thing as chronological age versus your biological age. So how are you keeping your cells healthy and young? Depends on how you're able to provide the supplements or substrates or nutrients that it needs coming from the food that you're eating. Okay, so I want to ask everyone, is micronutrient deficiency affecting your health? No, so maybe you can look and ask yourself these questions. No, so if you have any of this and your answer is a definite yes, especially if you're having a lot of yeses from all of these questions, then likely you do have what you call micronutrient deficiencies. Now, especially, of course, when you already have all those chronic diseases like hypertension, diabetes, even cancer, of course, autoimmune diseases, these are all indicators that those diseases would not have happened in you if your metabolic substrates that your cells needs, that your body system needs are stable or optimal. But if you do have deficiencies or even excesses at times of certain substrates, then that could definitely lead to um, you manifesting with signs and symptoms of having a micronutrient deficiencies. Of course, in my practice, I do what I call a nutrition-focused physical examination. As you will learn later on, that many of these micronutrients are utilized in different parts of your body. Hence, sometimes you see a constellation of signs and symptoms in different areas or in different systems of your body. And not only that, it's not limited to your physical, but even to your mental, emotional, and even the psychological aspect of your health can be impacted when you are manifesting with micronutrient deficiencies. So if you have any of this, no, or you're manifesting any of this, whatever is your age, no, remember, as I mentioned, our health is not a cycle, and that it doesn't mean that you don't have any formal diagnosis of any diseases. It doesn't mean that you don't have any bothersome symptoms, that is an indication that you are healthy. It only means that you're not yet sick, but it does not equate to mean that you are optimally healthy. Okay, so any answered yes there is likely a possibility that you do have a deficiency in one or more essential micronutrients. No? So, and if you're, as I mentioned, you have what I call the 3MD syndrome, you're manifesting with you have multiple doctors because you have multiple diseases, or you have you're taking multiple drugs. No, beware, protect yourself from drug muggers. No, I'll mention a few in my succeeding slides. No, so if you have pito-pito, no, pito-pitong doktor, pito-pitong sakit, at pito-pitong mga gamot na iniinom, likely many of these drugs are actually depleting you of several essential micronutrients that is needed by your body system as a whole. No? And RDI is required daily intake is not the be all end all. No? Oftentimes, even the food that we are consuming actually right now, they did a study done on the nutrient density of the food that we are consuming coming from real foods. Our harvest is actually lower by as much as like 50% or more than 50%. no, as compared to the harvest in the 1950s. So no wonder, no, there is this cascade of events wherein the timeline of your nutrient inadequacy, no, would translate into affecting or impacting your functional ability or functional capacity. And sooner or later, if this persists and progress because you're not able to correct it, that is when oftentimes you will manifest with some constellations of signs and symptoms. Or when I do my nutrition focused physical examination, like when I examine the nails, the gums, the hair, the scalp, no, or your skin, definitely. These are areas of our body that has high turnover rates. So meaning to say the requirement for all of these micronutrients and macronutrients as substrates are consistent and constant. Hence, oftentimes when you are definitely depleted, this is where you often examine, where you often see them. Or nowadays, no, at present times, we see a lot of we have an epidemic of mental health, no, and many of these people manifesting with neuropsychiatric, neurodevelopmental, and neurodegenerative conditions and diseases is due to deficiencies, no, in their tissue reserves, affecting their substrates level, and later on, those substrates level are important on driving an enzyme activity. Remember, you need an enzyme to be able to make all the biochemical and biological and physiological processes to be happening in each and every cells of our body to function. And but if you're depleted of it, then you're forcing your system to sort of like do a triaging system or prioritize. Hence, oftentimes there will be some that will be compromised. Okay, so this is a good slides wherein you can see, no, every organs of your body requires almost the same, no, the same macro and micronutrient levels. That's why oftentimes you also manifest with the constellations of signs and symptoms, even though it could just be secondary to just one single micronutrient, no, especially if that single micronutrient or several micronutrients are severely depleted, no. So but today I'm going to focus on drug-induced nutrient depleters, no. So what are the drugs that could really deplete you, as I call them, the drug muggers, no, from the book of Liz Cohen, no. So there, as you can see, no. So these are just some of the few medications, especially if you're taking antihypertensive medication. The sad reality here is that what many of these drugs are reducing, for example, antihypertensive medication that reduces your CoQ10, no, which is a required nutrients for your blood vessel as well as for your cardiac muscles, no. And if it will reduce your melatonin level, then you'll not be able to have a therapeutic sleep, and that particular sleep deprivation would actually lead to an elevated oxidative stress, and that elevated oxidative stress impacting on the health of your blood vessel, and your blood vessel will now not be that resilient or not that dilatable, or going to have increased resistance, leading to more hypertension. That's why no wonder, no. I often see in my practice a lot of people manifesting with resistant hypertension, resistant depression, no. They're already given several medications to control their blood pressure, to control their depressive moods or the symptoms associated with depression, and yet it's still not affecting, because oftentimes, as I mentioned, many of those conditions are actually due to the depletion of all of those micronutrients. And the more that you give them medications, then the more depleted you are, leading to more prominent manifestations. So you're going into a vicious cycle. Okay, so these are just some of the drugs that could actually deplete you, no? So the more drugs, the more you progress into that journey of having or manifesting with pito-pito, the more likelihood that you're really going to get stuck in there and develop more conditions as you go through it, no? And so these are just some selected drugs. If you're suffering from hypertension, or you're already manifesting with congestive heart failure due to your chronic heart diseases, well, many of these micronutrients are not only going to impact on your transportation system, your blood vessel health, no, on your vascular health, but they're actually going to impact as well on your immune system. on your communication system, on your hormone balance, on your detoxification system. So sooner or later, the more depleted, the more severe depletion you have of all of these micronutrients, the more diseases and conditions will develop in you. That's why you'll end up having this, no? The 3MD syndrome, no? Multiple doctors, being given multiple diagnoses and taking multiple drugs. So you're going on a vicious cycle. And in fact, many of the drugs that are given to you are actually just, or even the foods that we are consuming, many of them are actually designed to relieve you of the symptoms, because drugs are designed to manipulate the system, but they're not designed to address the root cause why you're developing those conditions or your diseases in the first place. Hence, if you are hypertensive, and oftentimes when you're taking some of these symptomatic medications, then which will lead to the elevation again of your blood pressure, and then which will prompt you to see your doctor. And if your doctor is not aware of this, then he ends up giving you or adding more medications to you that will further lead you to more depletion. So it's important for us to look into the quality of your nutrition so that you can utilize, no, your the sources of food in order to provide you with all of these nutrients or metabolic substrates that your system needs. Because, well, in the functional medicine practice or in the integrative medicine practice, we really do consider food as medicine. Food is energy. Food is information to your genes. And in fact, food is the way how we connect with each other, right? So, and not only that, food is actually mood, no? The quality and the nutrient density and how your food is prepared or what is added into your food could actually impact as well on your mental, emotional, and even the psychological aspect of your health. No? So when it comes to high blood pressure, no, we need to know that there are three important macronutrients, no, the PFC we call it, proteins, fats, and carbohydrates. So it's not really about calorie counting. What the key is about composition, no? So for example, for protein, which you can find both in animal sources or plant-based sources, it doesn't matter. But one example of a good protein that will that is an nutritionally essential amino acid is what I highlighted is arginine. You know, arginine is not only important for your blood vessel because it will provide that nitric oxide, but at the same time, or the precursor for nitric oxide. Remember, nitric oxide is a gas that can open up your blood vessel, and once the blood vessel, the more open it is, the more lower the resistance inside it. No, not only that, arginine is also good for your detoxification system. No, and if you are retaining certain toxins, like for example arsenic, no, coming from the foods or some personal items that you are consuming, then those arginine can actually impact on the health of your blood vessel, resulting to contributing to your elevation of your blood pressure. No, of course, arginine is also important. We know that insulin resistance or your insulin responsiveness, or how your body's utilizing insulin, would also contribute to the elevation of your blood pressure. Why? Because insulin, you know, is it retains sodium. No? And when more sodium you retain, the more volume, then resulting to elevation of your blood pressure. Remember, there are four reasons why our blood pressure elevates. Of course, the balance of the sympathetic and the parasympathetic, no, your blood volume. Of course, anything that is wrong with the renin, angiotensin, aldosterone system, and another factor that can contribute why your blood pressure will elevate, as I mentioned, is the health of your blood vessel, no, the health of your endothelium, and this could be circumvented if you have adequate intake of arginine. Okay, so indeed, food is medicine, not only the macronutrients, but even the micronutrients like vitamins and minerals. No, as you see later on, the importance of the balance and the synergy, no, just like a musical orchestra, how these several micronutrients will affect, or how it will be absorbed, or how it will provide the therapeutic benefit for you. So these are just some examples. No, if you're going to use food as medicine, similar to your drugs, it's very important for us to remember that there are therapeutic dosages. No, and I highlighted that in this particular slide. So many of these minerals, vitamins, and phytonutrients are how your trillions of cells are communicating with each other. So oftentimes diseases or symptoms or condition is a result of the miscommunication or the lack of communication. And one classic example, as I mentioned, is the insulin sensitivity or the insulin responsiveness of your cell towards allowing insulin to enter your cells in order for your glucose to be utilized as a source of energy. So many of those biochemical processes will require all of these micronutrients. So for example, for hypertension, so it's not only good to just lower down your sodium. What is important is to achieve the ratio of 5:1 between your potassium and your sodium. You know? So because it's not simply just when you reduce your sodium and yet your potassium is still depleted, then that will not make any much difference as far as providing control to your hypertension. Okay, so for example, so as mentioned there, 1 milli equivalent of potassium is about 39 milligrams, no, of potassium. So, but for you to be able to have to achieve the potassium level that we need, so that will be about 4,700 milligrams. Now, how do you get that from food? So, as I mentioned, when you use food as medicine, there is a required dosages, no? So for it to really provide the therapeutic benefit, no? So this is how you can get it, no? So you can consume this in one meal, no? And with that, you're able to provide the amount of potassium. And if one of the factors that contribute to why you have resistant hypertension is because of the lack of the ratio that you need pertaining to your sodium and potassium, simply not just simply reducing your sodium, but look into your potassium sodium ratio. Okay, so in fact, many of the foods that you are consuming contains all the micronutrients that could that has the same effect as your antihypertensive medication. So if you're taking calcium channel blockers, no, utilizing certain foods like celery, garlic, no, or different macronutrients like monounsaturated fatty acids like olive oil, no, all of these things can provide the nutrients that will contribute to your vascular health. And when your blood vessel is healthy, that will translate to the lowering of your blood pressure, similar to the effect or manipulation that your drugs is doing for you. Okay, so or sometimes what I do is when patients consult me, of course, as mentioned, I'm a general internist. I'm board certified in illness medicine as well. So when you come to me to my clinic and you're manifesting with a blood pressure of over 180/100, of course, I will be giving you a drug, no, to be able to control your blood pressure. But I will not stop there. I will have to investigate the root causes. Why are you manifesting? Why is your blood vessel unhealthy? What is it lacking? So that's why its muscular tone is affected, resulting to a higher resistance, and higher resistance resulting to elevation of blood pressure. Is it lacking in certain micronutrients like a mineral like magnesium, no? Or are you lacking with a very important antioxidant? So sometimes this is what I do in order to achieve the same impact. So when I combine these micronutrients through the food that I want you to eat, or if there is really indeed severe deficiencies of all of these substrates, then I'm going to be able to achieve a synergistic effect with regards to your antihypertensive medications, and that later on leads to elimination for you to have a maintenance medication. But mind you, I'm not the one discontinuing the medications. I leave it up to your attending doctors. No, but of course, once they see that your blood pressure is really going down because there's a synergistic effect coming from all the micronutrients coming from the food that you're eating, then definitely your doctor will have to discontinue many of the drugs that you are taking. So statins, of course, well, one of the top grossing drugs that was utilized, especially several decades ago, even before a lot of information of its harmful effect came out. No, so many doctors were actually conditioned to prescribe this, no, to achieve a certain level of cholesterol. But we now know that there's nothing wrong with cholesterol, not unless it's an oxidized one. It's not only important to know about the cholesterol numbers, but also important to know the particle size, concentration of the cholesterol. That is what will matter to the health of your blood vessel. But if you're given statins and your doctor is not aware that this is one classic drug that can really deplete you of so many nutrients or micro and macronutrients. As you can see there, many of these micronutrients are actually vital as well for the health of your blood vessel. So you end up developing another condition, which was supposedly the reason why this drug was given to you. But since many of these drugs like statins is depleting you of the nutrients that your blood vessel needs, then another problem or condition develops. Like this can affect your, for the males, no, or even for women, no. So because even though you're babae po kayo, you're also producing testosterone. There's a certain level of testosterone. You know, when it comes to our hormones, we don't treat them in isolation. We treat hormones just like a musical orchestra as well. So the harmony and the symphony and the balance of each of these hormones is also important. So one drug to address one symptom causing micronutrient deficits, leading to impact on your production of your hormones and that balance of that particular testosterone or optimal level of the testosterone, impacting and developing more conditions. No? So that's why when I deal with cholesterol, no, so I'm not saying that having an elevated cholesterol is something that we should just disregard, no. But as I mentioned, let's not just look at the cholesterol as a number, but look at it because cholesterol is a molecule that 70% of it is produced by your own liver. Why does the body needs to produce cholesterol? Because the body needs to use cholesterol as a way to produce your hormones. No? So oftentimes, when you're seeing elevated levels of cholesterol in your blood chemistry, it doesn't mean that a knee-jerk reflex is to bring it down. We need to understand why. Why are your cholesterol levels elevating? No? And this elevated cholesterol, not just in numbers, but what are its particle size? What are its particle concentration? So for us to really be to see its risk or significance to the health of your blood vessels. So oftentimes, addressing cholesterol issues, I utilize many of the micronutrients, especially if I'm dealing with elevated triglycerides, which is an indication that your glucose metabolism is inefficient. No? So, and this is how I correct it. No? So utilizing several micronutrients or even fermented foods like probiotics, or some considered to be superfoods like pomegranate, no, or berberine, that definitely would contribute to your insulin responsiveness or insulin reducing your insulin resistance. No, so to see there are evidence as to support why many of these micronutrients or natural substances or ingredients coming from your food is definitely going to make a difference in addressing your cholesterol metabolism issues. Or of course, when you're suffering with hypertension, that's the start. Then later on, you develop a lot of complications, especially if you're manifesting with resistant hypertension, and this resistant hypertension resulted to cardiovascular complications, and those cardiovascular complications leading to you manifesting with chronic arrhythmia. But do you know that the pacemaker of your heart is also affected? Its function, just like your blood vessel, can also be affected by the several micro and macronutrient levels that it needs in order to perform its function of providing rhythm to the to your heart, no, to the contractions of your heart, no. So many different kinds of arrhythmia, whatever you call them, tachycardia, bradycardia, whatever is the name, no. Oftentimes, this irregular rhythm is a manifestation of micronutrient deficiencies as well, or an excess of a substance like caffeine or alcohol that could result to affecting the optimal function of your pacemaker. So much for hypertension and heart diseases. Let's go to diabetes, no, or oftentimes for those of you who do have all of this, no, high blood sugar, high blood pressure, at the same time manifesting with cholesterol metabolism issues, and oftentimes having this having what we call the visceral obesity, no. So, and once you manifest with this, what is the common drug that's given to you? Of course, metformin, which is a good drug because it would provide and actually address insulin resistance. No? But metformin can also deplete you, particularly of vitamin B12. No? The problem with vitamin B12, one of the water-soluble vitamins, that it plays so many functions, no? Not just on your blood sugar, but even on your other systems, no? Even on the production of your DNA and RNA. No? So definitely vitamin B12 would contribute to why you're going to develop certain mutated cells and later on leading to certain conditions such as cancers, or why you're developing cysts in almost all organs of your body. Or vitamin B12 is also important for your mental and your emotional health. No, so it's involved in the production of neurotransmitters. So if you're going to maintain yourself on all of these drugs, I hope you're able to know and measure your vitamin B12. No, so oftentimes, even if you're, how doctors provide you metformin, once you exceed that target level of 100 milligrams per deciliter, they'll call you now as having pre-diabetic. No, but if you're just going to find out what's causing your insulin resistance, or you're affecting your insulin responsiveness, then you need not to maintain yourself on metformin as well. No, and so many other micronutrients can actually also impact your insulin resistance or your insulin responsiveness. And oftentimes this is often overlooked. No, so you know that insulin resistance happens decades prior to your fasting blood sugar will become abnormal. No, so in fact, I've seen many patients wherein the complications, the microvascular and macrovascular complications of diabetes is already happening to them, and yet their fasting blood sugar level is still normal. Because before that becomes abnormal, there's something that will become abnormal first, and that is your insulin responsiveness, or for you to develop what you call insulin resistance. Many of these micronutrient recommendations that I'm showing now on my slides could actually help, no, in enhancing your insulin sensitivity and insulin responsiveness, which later on translates to the efficiency or optimal function of your glucose metabolism. Later on, if you have diabetes, and this is the reason pala why you develop diabetes or why you're labeled to have diabetes, no? Once you address all of these micronutrient level deficiencies, then you will prove to yourself that you can reverse your diabetes. No? So when it comes to the functional medicine approach, no, especially even with those people who suffer from chronic diabetes and they're now manifesting with the chronic microvascular and macrovascular complications of diabetes, oftentimes those complications are also manifestations of deficiencies of both micro and macronutrient levels. No? So to address that, these are some of the combinations that I give, like of course the B vitamins as well as carnitine, which is which is important for fatty acid metabolism, and of course alpha lipoic acid, a very important antioxidant, not only important for your glucose metabolism, but also important for your nerve health. No, it's also important for your cardiac muscle health, as well as definitely important for your vascular health. Okay, so for diabetics, oftentimes this is what I give. Later on, I'll teach you that even the formulations on how your micronutrient supplementations are made matters a lot as well, especially to its absorption, or even the combinations of all your micronutrients matters as well and will impact as well on its absorption. So these are just some of those that I could utilize, especially for those chronic diabetics. No, the more poorly controlled your blood sugar, the more that this peripheral neuropathy will manifest prominently. And oftentimes, the sad reality there is that you're given a medications, a symptomatic treatment for it. Sometimes, especially if the neuropathy is really affecting you with pain, affecting your sleep, then you'll end up being given a pain medication or a pain suppressant, which will contribute more to resulting to more insulin resistance, no? And to a cascade of so many problems. So, and of course, as mentioned, there are important nutrient interactions. If indeed you do require maintenance medication at this point in time, it's very important for you to know that combinations of several medications, no, together could have a combined effects resulting to more or severe depletion of all of these micronutrients, no? Especially if you are manifesting with polypharmacy. So it's important that your doctor is aware of all of these important nutrient, drug nutrient interactions. Later on, I'll share with you an app that you can utilize. No, you just how you can find out your nutrient, what nutrients are likely you're depleted of. No? So here it is, pala. So medications and nutrient interactions. So this is what we call the MyTavin. No, so if you want to try this, just put in your drugs, no, the generic name of your drugs, and it will tell you what are the likely nutrients that you are depleted, what are its symptoms, and if it's present on you, and if you need references, no, research and scientific evidence for why all of these nutrients are depleted in you because of the drugs that you're taking, then that can be provided to you as well. No? So when it comes to indeed, if you, as mentioned, it's no surprising that majority of us are micronutrient deficient. I'm not here to advocate supplementations. I'm here to face the reality that indeed our nutrient density or the quality of our nutrition is not the same as compared, let's say, 50 years ago, no? Especially for our children. Hence, oftentimes I end up really prescribing or providing supplementation, especially nowadays that even that in the US as well as in Europe, micronutrient levels can now be measured. No, not only the micronutrient levels, even your macronutrients, but even the metabolites. No, what happened to your nutrient levels after your cells utilizes it, that can also be measured nowadays. So if I have evidence that that person is really manifesting with severe micro and macronutrient levels, then I would definitely provide an optimal supplementations. But for today, I'll talk about the ABCs of optimal supplementation. What affects its absorption? Why is it that some of you're buying personalized prescription to yourself now because you've learned from the internet? What does affect its absorption? Why what it claims to be its therapeutic benefit is not happening to you? No? So because, as mentioned, delivery system is the key here. No? So many of the supplements that you are taking, it's important for us to understand its purity, its potency, no, and its identity. No? So if it's made from capsules or tablet, no, the disintegration timing is important. No? So it's important within the 20 minutes that it disintegrates in order for us to be able to absorb it. No? So, but one study from the Journal of Pharmacy and Pharmaceutical Sciences, based from all of those commonly prescribed commercial brands of multivitamins and multiminerals, no, 51% did not disintegrate within the allotted 20-minute window, and that will definitely affect absorption. So, so if it's not a capsule, because capsule affects a lot, or tablets will affect its absorption. Well, according to certain studies, liquid formulas is the most absorbable. The problem with preformed liquid formulas is that its transportation from its manufacturing to the transportation up to the counter where you're going to get it, it can actually be affected by so many factors. No, so it can affect. It can be affected by light, heat, temperature. No, so that's why oftentimes this will disintegrate. No, so. And if it's disintegrating, so oftentimes we're just taking really a placebo effect of it, and all the nutrients, the stability of the nutrients are affected already. Or sometimes the person itself, no, there are certain conditions. Of course, if you've heard of the term leaky gut or intestinal permeability, wherein the ability of your small intestines to affect the absorption, or it results to malabsorption, especially if you're post-bariatric or you're manifesting with irritable bowel syndrome. Most likely, no, if you're, I assume that many of you are appreciative of the gut health, no, particularly the health of your small intestines, no, the main organ that helps us assimilate all the nutrients. So if your gut health is compromised, this will definitely impact on the ability of your system, of your assimilation system, to assimilate all of the nutrients that your system needs. So no matter how optimal are your nutrition, or even if you're taking the premium brand of supplementations, definitely it will not be absorbed, and you'll probably be urinating the most expensive urine in the world, no? So, or worse, no? So there are cases wherein, especially in preformed vitamin formulations in liquid, no? That once it gets degraded, no, it can result to a production of an antagonistic element that could degrade other micronutrients. One example is, of course, vitamin B12. No, it can break down and release a cobalt ion that can destroy vitamin B1 and B6. No, so that will definitely impact on how much you're going to be able to absorb. Or sometimes worse, no, especially that's why I'm not into, especially for children. You see, no, they're giving away fish oil in gummy formulations, no, or sometimes do you ever wonder why a multivitamin for males is colored blue and for females it's colored pink, no? So sometimes there's so much add-on, and definitely this will impact on how much you're going to be able to assimilate as far as the micronutrient is concerned. But because many of these ingredients, if it's added into your multivitamin and multimineral, is going to limit, no, the amount or the nutrient density that you're going to be able to assimilate or absorb, no? Or worse, as I mentioned, if you're suffering from chronic digestive symptoms and you've been given a lot of acid suppressing drugs or acid suppressants, no, like proton pump inhibitors, no, this will definitely affect certain the ability of your micronutrients. For example, calcium, magnesium, zinc, iron, chromium, molybdenum, manganese, copper, especially if you're suffering from what we call hypochloridria. Now, what is hypochloridria? That is low stomach acidity, the opposite of hyperacidity. Do you know that low stomach acidity and hyperacidity, they can manifest with the same symptoms? So if your symptoms of bloatedness or chronic digestive symptoms is due to hypochloridria or achloridria or low stomach acidity, and yet you're going to symptomatically treat yourself with an acid suppressant drugs without finding out, is it due to hyperacidity or a low stomach acidity, then you're going to worsen your condition. And not only that, you're definitely going to impact or affect the ability of your stomach as well as your small intestines in assimilating the different micro and macronutrient that your system needs. No? So that's why it's important for us to understand the beneficial quantities and forms of your multivitamin. So if you're holding your multivitamins there, no, so does it contain 500 to 600 milligrams of calcium? Because you know, calcium, even if you're taking 1,000, why is it that they require 1,200 milligrams calcium for females, especially for those who are menopausal or those who are manifesting with osteoporosis? But you know, even if you take 1,200, if you're going to take that together, the ability of our system to absorb is only up to about 600 milligrams of calcium. That's why it's oftentimes, sometimes we separate them, no, into a daytime and a nighttime dosage, no, in order to consider this ability of our body. So, for example, why is it that now a lot of people are being required to take in mega doses of vitamin D3, no? So if you will look at it, no, so that 6 minutes under the sun will actually provide you about 10,000 IU of vitamin D3 already. Can you imagine our ancestors then, how much exposed they are into the sun? Because of course, when they want to eat food, no, they have to hunt for it, no. So how much vitamin D3 do you think they have, no? So especially that vitamin D3 receptors is present in almost all of the cells in our body, no. So that's why it's important for us to achieve the optimal level of vitamin D3, you know. So, but as a maintenance, 2,000 IU is a good dose, but we also have to remember that vitamin D3 has toxicity levels, no. But optimal levels in nanograms per ml should be at least 50 to 80 milligrams of vitamin D3. So it's important also to know, what are you taking? Is it the vitamin D3 or the vitamin D2? Is it the ergocalciferol or the which is the inactive form of vitamin D3, or the active form of the vitamin D3, which is the cholecalciferol, no? So important for you to check all of this. Methylcobalamin, most of the cheaper brands of vitamins contains the cyanocobalamin or the synthetic formulation of this. But that is not a bioactive formulation of vitamin B12. No? So that definitely will impact, a synthetic formulation of vitamins before they can be impacted, before they can be absorbed, needs to be activated. No? So, but oftentimes activation of synthetic formulation of vitamins may require energy. But if you're already suffering from chronic energy deficit, then how can you activate? And you probably just be wasting your synthetic formulations of vitamins. Now, why is it important for your multivitamin to both contain niacin and niacinamide? Well, if you have high cholesterol levels, niacin can help in your blood glucose control, especially if you're diabetic, but niacinamide is the one that could make a big difference in your cholesterol metabolism. No? So why is it important for you to have at least 2,500 IU vitamin A as retinol acetate or palmitate? Because if it's just the beta carotene that is the vitamin A formulation contained in your multivitamins, these are the inactive forms, and many of this, it's difficult to activate. So it's important to guarantee that you have a certain amount of retinol acetate or palmitate, so that, because this is the bioactive component of vitamin A. No? So why is it important to contain? Most multivitamins does not contain vitamin K1 and vitamin K2. No? So, but both are important, especially for your blood vessels. The vitamin K2 could actually impact on that, as I mentioned a while ago about nitric oxide. No? Vitamin K2 can also help in if you're suffering from neuroregenerations, no? Or it could also contribute to your clotting ability, especially for the vitamin K1. No? So it's important because each of these compositions have different functions as well. No? Why is it important for your folic acid to be in the methyl tetrahydrofolate formulation? Because a big percentage of the population could have a mutation. We call it the MTHFR mutation, wherein you're not going to have the ability to convert your folic acid into bioactive to its bioactive compound, and so that's why it's important to take in an activated form, which we call the methyl tetrahydrofolate. Okay, so why is it important to contain the 8 forms of vitamin E, mixed tocopherols and tocotrienols? Because many of these have different functions. No, so this vitamin E are split into 2 kinds of families. No, as I've said, tocotrienols and tocopherols. No, so not all of them may have as potent as far as antioxidant function is concerned. No, so the tocotrienols is the more potent, higher by 60% as far as its antioxidant property is concerned. No, and make sure that that your multivitamins does not contain copper. Okay, because copper will serve as a competition to almost about 10 of the micronutrients that is contained in your multivitamins. So it's important for you to check. No, so look at your multivitamins. No, so whether many are this do they contain all of this, or do they not contain many of this? No, or what are do they contain the bioactive components? Like for example, for vitamin B2, we prefer the riboflavin 5-phosphate rather than the riboflavin hydrochloride. No, for the bioactive component of vitamin B6, pyridoxal 5-phosphate. No, so very important. And of course, sometimes there are multivitamins and multimineral formulation that already contains the phytonutrients or phytochemicals that are important for, that serves as has an potent antioxidant properties. Many of them have immune modulating properties. An example would be quercetin, grapeseed extract, which are very much potent for its antioxidant properties. So if you have this, especially if you're not fond of eating vegetables or you're not into plant-based foods, it's good to look for formulation of a multivitamin and a multimineral that contains also phytonutrients and phytochemicals. Okay, because as I mentioned, not only absorption and the beneficial forms and dosages and amount that is important when it comes to your multivitamin and multimineral formulation, we also need to consider that there are certain there's certain competitions happening in when it comes to your different micronutrients. That's why we treat this micronutrients like a musical orchestra. You know, in a musical orchestra, there are different groups of instruments like woodwinds, for example, the brass, the string instruments, right? So the same thing when it comes to our micronutrients. So we have the amino acids, you have fatty acids as macronutrients, as well as with regards to your micronutrients like vitamins and minerals. No, even from the way they're formulated, so they can have what we call chemical competition. So a classic example of that will be when you combine both, let's say, vitamin zinc together with vitamin B9. No, so together they can form an inabsorbable complex wherein it will prevent you from absorbing both micronutrients. No, or sometimes the chemical competition, even before you ingest the multivitamin, there could also be a biochemical competition wherein after you ingest the vitamins, no, so wherein they will be competing. No, an example will be, for example, lutein and beta carotene. No, so they can compete, no, for the absorption, no, for that receptor site, wherein you end up not taking anything at all, no, if you combine them together. So that's why sometimes there are good formulations wherein in powdered formulations of multivitamins in different sachets, separate sachets or a sachet per day, that's the best formulation of a multivitamin. Because if you're going to utilize, sometimes liquid formulation can not only come in a preformed liquid form already, but can come in a powdered formulation. The problem with the powdered formulation in a canister is that not all micronutrients have the same weight, right? So you end up later on, especially before you consume the entire canister of your multivitamins and multiminerals, many of the minerals are already at the lower bottom of and then you end up, when you scoop it, no, to get the amount that you need for the day, you are going to take in more of the minerals, and many of the light vitamins are already consumed, no, if you're almost finished with that particular canister of powdered formulation. That's why the best formulation will still be a powdered formulation, but should come in separate sachets so that you get the right exact amount of it. No? So, and of course, there's also such a thing as physiological competition. This happens after absorption of the micronutrients. So a classic example of this is what's happening, for example, between copper and vitamin B5. No, so if it's going to limit the intake of your, they will be competing against each other. No, so for it to provide the therapeutic effect. No, so and oftentimes when micronutrients are in competition as well, they could actually cause what we call clinical competition. This one, an example would be your vitamin B9 or your folate could actually mask your vitamin B12 deficiencies. No? If you're taking a lot of vitamin B9 and you're not able to measure and you have a lower levels of vitamin B12, the problem there is that your vitamin B12 is important for your red blood cell production. It's very important, as I mentioned, for your DNA function, right? So if you're unable to know your levels, then that's going to cause what we call clinical competition. So as I've mentioned, the way we look at all of these micronutrients, no, vitamins, minerals, as well as the fatty acids, macronutrients, like fatty acids and protein amino acids, is like a musical orchestra. Can you imagine a musical orchestra? All the instruments are playing together and not following their musical sheets, no? So there's no conductor. Will you be able to produce a beautiful symphony or music there? No, of course not. No, you're going to. So the timing and the rhythm and the balance and the synchrony of all of these micronutrients is important to consider because it will affect their absorption. It will affect their therapeutic dosages. It will affect their therapeutic benefit for you. Okay, so make sure, as I mentioned, I already indicated a while ago why B9 and zinc does not contain both B9 and zinc in the same dose, because there is really competitions going to happen. No, so lutein and beta carotene, B5 and copper, because of the competition thing. So it's important for you to be able to develop this synergy. No, the opposite of competition is synergy, and that is where at times, well, I read this from a book of the same title, The Micronutrient Miracle, about the anti-competition technology that is already being formulated or utilized right now in making your quality and premium formulations of multivitamins and multiminerals. As I mentioned, this competition, like out of the 34 micronutrients that we need, vitamins and minerals, there is actually about 48 competitions happening. No? So much na pag binanggit ko pa bawat isa, but 48 competitions. Each one of these micronutrient is competing against another micronutrient. So out of the 34, so 48, that's about 88%. No? And then out of this 34, no, there are about 15 that will compete against 3 other micronutrients. So that's about 44%. No? And at the same time, there's one micronutrients that competes against 10 micronutrients, and that is your iron. No? So iron competes against 10 micronutrients. That's why it's best for your multivitamins and multiminerals not to contain any iron at all. And of course, you know that too much iron, especially both for males and females, it gets deposited in your liver. In fact, there is a condition called hemochromatosis that could actually because if you're taking iron and you have excess levels of iron. Okay, so how do you personalize your micronutrients for your specific health condition? So for example, if you're not yet diabetic, but let's say if your fasting blood sugar, as I mentioned, I don't wait for the fasting blood sugar to become abnormal. If you are very young, especially if you're below 60 years old, and yet your fasting blood sugar is already above 81, or in fact above 85. Sige na, if you're about 40s or 60s, but the optimal level should be about 81 or 82 milligrams per deciliter. That's the optimal level of your fasting blood sugar. But if your fasting blood sugar is below, let's say 96, no, and you're below the cutoff that endocrinologist utilizes, don't be happy about it, no. It's important for you to compare. Look at your fasting blood sugar a year ago or 2 years ago. If your fasting blood sugar is very optimal at below 80, no, and suddenly after a year it's now 96, so things have happened. Something affected your carbohydrate or your glucose metabolism efficiency. And oftentimes, this glucose metabolism efficiency, meaning to say how your body system utilizes all the carbs that you're going to eat and convert them into energy, will require a lot of these cofactors. So it's good if you can check your vitamin B3, B5, B6, B7, or your antioxidants and vitamins at the same time, like your vitamin C. If you're deficient of all of these vitamins and minerals, possibly this is the one contributing to the inefficiency of your glucose metabolism processes. Okay, of course, I'm not directly telling you to just take vitamins and minerals. Look at the quality of your food, no? So if it's been years or decades that you have not eaten many of these nutrient-rich food sources that contains many of these beneficial micronutrients, if you're suffering from blood sugar regulation, then might as well just consider eating first these kinds of foods, no? Or if you are suffering from resistant hypertension, you already have polypharmacy, no? You're taking 2 drugs or 3 drugs already for your hypertension, and yet your blood pressure, when your doctor checks it, it's still elevated, or the different so many micro and macrovascular complications associated with hypertension is still happening to you. Your kidneys is still failing. You're still manifesting with ischemic symptoms. You're manifesting with symptoms in the brain, in the heart, no? Then most likely, it's now time to just not simply focus on the blood pressure, but focus on the root causes why your blood vessel is unhealthy, resulting for it to having elevated resistance, manifesting as an elevated blood pressure. Check many of these micro and macronutrient levels. Is it optimal? So as I mentioned a while ago, everything can now be measured. You know, when I was studying med school 19 years ago, or 21 years ago, when I was still in internship, no, there was no way of measuring all of these micro and macronutrient levels. Everything when it comes to medical advancement in technology in medicine is all focused on the organs. No, is there evidence in the organ that there is already a disease? No, but nowadays a lot of technology is available to measure how healthy are your cells. No? So another condition, of course, many of you suffer from, especially for women. Remember, many of these bone conditions like osteoporosis and osteopenia is due to mineral deficiency, right? But you have to remember, it's not only about vitamin D. The interplay between magnesium, vitamin D, calcium, phosphorus, as I mentioned, they are like a musical orchestra. So taking one mineral and forgetting about the others will not cut it out. No? So even if you're taking vitamin D, if you're magnesium depleted, then it will not make much big difference as far as your bone strength or bone building function is concerned. In fact, if you're taking so much vitamin D and you're forgetting about magnesium, no, you'll actually be manifesting with muscle cramps, because when you're taking so much vitamin D, and it's going to bring out all your magnesium, and if you're magnesium depleted, that will have an impact not only on your muscles, but even on your nerves or even on your heart muscles, leading to, as I mentioned, arrhythmia. Okay, so see, starting from the bones and then affecting the heart or your blood vessel, right? So as I told you, the body as a system, from a functional medicine perspective, are actually networks of integrated, interconnected, and interrelated systems. That's why managing your health really is very much different in managing your diseases. Okay, so for hormone regulation, especially for those women listening right now, you ever wondered why is it that some women, when they go through menopause, they just breeze through it? Others, they really suffer. Like I had one patient, she was 41 years old. No, she was based in Korea, and she had an early onset of manifestations of perimenopause to menopause. No, and this resulted for her to manifest with chest pain and elevation of blood pressure. But that was just part of the imbalances of the hormones affecting her system. No, but she ended up having to go through an angiogram. No, and of course the angiogram was normal, but that was just part of how balanced or imbalanced her hormone levels are. No, so the balance between the estrogen and the progesterone, because she was on the heavy side. No, she was depositing more of the estrogen, and there was really a deficiencies of progesterone. And because her hormone levels, remember, all of these hormones, for it to be utilized by your system, you will also be requiring cofactors like micronutrients and vitamins and minerals in order for it to be utilized by your cell for its functions and purpose. So your hormone imbalances is not limited only to your hormone levels. No, even if your doctor is knowledgeable about hormone replacement therapy, but if you're not able to replace the micronutrient levels that it needs in order for it to be assimilated or utilized by your system, then you'll end up not benefiting from your hormone replacement therapy as well. Okay, so I think that's my last slide. So thank you. I hope you learned something and you get to be more inquisitive about how you look at the purity, the potency, and the quality and identity of your multivitamins and multiminerals. So be very, very careful of what you're taking and make sure that you do need it. No? So here we really practice measured wellness. So if you can measure your disease, you can definitely measure your level of health as well. So it's good to measure. So you'll know, because remember, each one of us has what we call biochemical individuality. Each of these micronutrients, we have a specific needs or levels that our system needs. So it's important for you to measure. Thank you.
Wow, thank you, Dr. Oyie. I really like the part where you explained about the synergies, because most of us just we shop for supplements. Diba, we hear na, this is good for you, this is going to boost your, especially now, ang daming supplements sa internet. Like, vitamin D for COVID, and I like that synergy part. I read some questions from our listeners. Doc,
yes, sure, please.
a viewer wants to know, sabi niya he has a family history of hypertension. Though he's not hypertensive yet, he wants to know if he can already take the supplements that you mentioned. Aside from, of course, watching his diet now, to help him prevent being hypertensive in the future?
Well, as I mentioned, especially for water soluble vitamins, our body does not have the ability to store that as compared for the fat soluble vitamins, no, where we can store that in the liver, we can store that in our fats, no. But if your body does not need it, then you're just gonna waste your money. That's why it's important for you to measure, no. If you don't want to measure, then look at seek the help of a nutritionist, no, hopefully a functional nutritionist, and that nutritionist is trained in determining, no, the different allocations of the micros and the macronutrients, or the nutrient density of each different specific food ingredients that you are consuming. And then from that food journal analysis, because your nutritionist will be determining your food journal analysis based on the 1 week food diary that you're eating. So if you're able to provide that to yourself, no, and that particular food diary is the representation of your food intake, then you probably might not need any supplementations. But if you really want to find out, as I've said, how much is the optimal level that your system needs, considering the fact that possibly there is also a genetic factor present in you that could contribute why those things happen to your parents, no, then if you can supplement or provide the optimal levels of micronutrients, then that will truly benefit you. So as I've said here in BioBalance, we do personalized, precise, no, medicine, no, precision medicine, and personalized medicine. So we customized everything. So we need to get data for me to really say that it's good for you to take all of those. But all I can say is each of these micronutrients play a different role when it comes to your vascular health. No? Or maybe let's go clinical. Let's look at the risk factors present in you. Do you have visceral adiposity or visceral obesity or central obesity? If you can do your body
In-body.
analysis, if you don't have the time, you're scared to go out, measure your waist to hip ratio circumference. No, if you're a female, if it's more than 0.8, no, especially if it's above 1, then you're manifesting already with some cardiometabolic risk and predisposition. Then I would say you will benefit from taking all of these supplements, no, especially the ones that are important for your blood vessel health. Or look at your blood pressure, no. So you measure your blood pressure in the morning, no, for 1 week or 2 weeks, no, every morning upon waking up, and then measure them again at nighttime, no, especially at around 10 o'clock in the evening before going to bed. If your blood pressure physiologically should be reduced by 15%, no, your average blood pressure at daytime should be lower by 15% at nighttime. So, but if it's not, your blood pressure is not dipping, even though you're not yet hypertensive. If your blood pressure is not dipping, that is a reflection already of how healthy is your blood vessel or not. Then you can look at your food intake. Am I taking magnesium? Am I taking vitamin D? Am I taking a lot of antioxidant-rich foods? Am I taking a good balance of sodium and potassium? Then again, that is already an indication that you can take all of those supplementation. Or sometimes I do a nutrition focused physical examination. I look at your nails, I look at your tongue, no? So when I see your tongue and look at your tongue in the mirror, if you see a lot of cuts there, no, like sometimes you can even form a shape there, a lambda or a delta shape there. Those cuts, no, in the middle, especially if it's a very prominent cut, that is a manifestation of severe protein deficiency or amino acid deficiency. So there's so many ways. Your body can tell you so many evidence of why that you are indeed suffering from micronutrient deficiencies.
Wow, thank you, Doc. There's another patient already taking simvastatin. She wanted to know whether she should wait for the side effects of the medication to set in, or could she already take the vitamins that you recommended?
Many of this, as I mentioned, Marius, our system is an adaptive biologic systems. Many of the micronutrient deficient individuals, they don't manifest with any symptoms. No, so if you wait for the symptoms to happen to you, that means to say your system is already pleading you or telling you that something is wrong and that you need to do something about it. That's why we always say in BioBalance that, or according to our mentor, my mentor, Dr. Ted, that does not having no diagnosis of any disease, no, or not having any symptoms that affects you does not equate to mean that you are healthy. It only means that you're not yet sick, no, but that's not equivalent to that you can say to yourself that you are optimally healthy. There's a big difference there. If you're going to wait for the manifestations of the different nutrients that will be depleted when you're chronically taking all statins, then you might regret it, because oftentimes, as I told you, sometimes the complications happens already even before the laboratory tests manifest with any abnormality, especially if the test that you're doing is an organ-based test.
So better to take already when you have a
Yes,
medicine.
in fact, cardiologists nowadays, those cardiologists that are updated in their continuing medical educations, when they give statins, they already automatically give ubiquinol or CoQ10, especially if their patient is manifesting with ischemic symptoms or muscle cramps or chest pain. No? So they already give, no, together with the statins, the ubiquinol, because they know already that this particular drug is a drug mother.
Doc, for a 49-year-old naman, with a sugar level of 130, I'm not sure if sabi niya diagnosed na siya as diabetic. Can you already take the supplements that you recommended early on? Are there spacing? Like, can I take it together with my anti-diabetic medicines? Or hindi ba super bababa ang aking blood sugar levels?
Well, we have to remember, Maris, I mentioned about insulin resistance as commonly the reason why many people are having glucose metabolism inefficiency. No? But in this particular insulin resistance, one possible cause of that is when you are having micronutrient deficiencies. But there are other causes why a person develops insulin resistance. No, many of those factors connected to our lifestyle and our environment. If you're not going to be able to address that, and many of those factors are the reason why you're manifesting with insulin resistance, not just your micronutrient deficiencies. So even if you take your micronutrient levels that are important in your glucose metabolism, like your vanadium, your chromium, your magnesium, your vitamin D, your zinc, no? Even if you're taking all of that, if the other root causes why you have insulin resistance is not addressed as well, then you continue to be insulin resistant. No? It's like the analogy that we were taught here is that when you sit down and the chair that you sat down on have 15 thumbtacks, removing one thumbtack will not alleviate the pain, no, if the other 14 is still there, right? So that's the analogy that I will use. So we need to investigate, no, why is it that your system is having problem in metabolizing your glucose and converting them into energy. Your glucose level is not the problem. The problem is the inefficiency of your body system in utilizing glucose and bringing them inside your cell and converting them into chemical energy called ATP. That's the problem. So just by taking the drugs that suppresses the glucose level does not equate to mean that you've addressed the root cause of the problem, or that the damage that elevated blood glucose in your blood is not happening anymore. It's still there, because what the drug is doing is it's hiding the problem. So it's not resolving the root cause of the problem.
Doc, you mentioned an app earlier. I just wanted to make sure that we got it correctly.
It's called MyTavin. MyTavin. So yeah, for our listeners who are suffering from yung may pito-pito or 3MD syndrome, no? If you're taking several drugs, you have polypharmacy, you can utilize that, no? I'm not sure if it's for free or there's a payment for it, but it's a good way to really be able to find out what are the micronutrient levels that you are deficient of, no? But of course, importante pa rin to know the exact level, no, to measure, no? So that's just a guide, no, to a good starting point for you, no? But sometimes kasi what makes the difference, Mary, is why, Doc, I'm already taking this. According to Dr. Google, this vitamin is important. This vitamin can resolve my this and that, no? Because oftentimes, as I told you, dosages matters as well. No, dosages matter because we have what we call biochemical individuality. Maybe to you, Maris, you will require 2,000 milligrams of vitamin C, but me, my stress level, my activities, I require 5,000 milligrams of vitamin C. So it's good to know if you measure. Or sometimes, as I mentioned, if you have any conditions that affects your assimilation system, your gut health, no, then you may require a higher or supra-optimal dosages more than what is placed there in the recommended formulations in what you bought as a vitamin, because your body system will have a hard time assimilating. So many of it will probably be lost. Hence, you may require a higher amount. So that's what we say: personalization and customization.
Okay. Thank you very much for the learning session today. If any of the viewers are looking for professional grade and quality supplements, you may visit our website and use the promo code Restore Health to get a special discount. And if any of the viewers have any questions, just feel free to message us in our Facebook. We'll relay them to Dr. Oyie. And if you want to see him in person, say consultation, or any of our in-house doctors at BioBalance, just message us through our details below, whether a landline 6504858 or 0917-521-4860. Again, thank you, Dr. Oyie. Thank you
Yeah.
very much. I've learned personally also. Thank you. Very, very interesting topic today.
Okay. You're welcome. Thank you. Stay safe and well. So I hope you get measured now with regards to your micronutrient levels, so that you know how much your system needs, so that you can avoid, or you can actually reverse your chronic diseases and avoid developing more complications, and you can take back your health. Thank
Thank
you.
you. Thank you, Dr. Oyie.
Thank you.